Hello everyone, welcome back to my channel. So in the previous video we did questions from question number 20 to question number 40 of the chapter Child Psychology from the subject Pedodontics. Now we will start from question number 41. Okay, so let's begin. So question number 41 is, extinguish of fears on successive dental visits is an example of. So the answer is option D, desensitization. Extinguish of fears on successive dental visits is an example of desensitization. Desensitization is an effective method for reducing maladaptive behavior. It is accomplished by teaching the child a competing response such as relaxation and then introducing progressively more threatening stimuli. Okay. Now question number 42. Making the child observe when a dentist is working on a cooperative child is an example of. So the answer is option A, modeling. Modeling is based on social learning principle, allowing a patient to observe one or more models demonstrating positive behavior in a situation. For example, live models, siblings, parents, filmed models, posters, or audio visual aids. Okay, now question 43. Psychological basis of tell show do technique is. Option A, desensitization due to familiarity. Option B, overcoming the influences of overindulgence. Option C, distraction from unpleasant things. Option D, all. So the answer is option A, desensitization due to familiarity. Indications of tell show do technique. So the indications are child more than 3 years of age, fearful child, and the first visit. So these are the indications of tell show do technique. Child more than 3 years of age, fearful child, and first visit. Tell show do is the most popularly used technique for modifying behavior by desensitization in children. Okay, another question on the same topic. The non-pharmacologic technique that has remained a cornerstone of behavior management is. Answer is tell show do technique. Now question 44. Best approach for managing of 6-year-old child with temper tantrums is. So the answer is option B, voice control. Best approach for managing of 6-year-old child with temper tantrums is voice control. Voice control is the effective communicative technique using sudden and firm commands to stop the disruptive behavior and to get the child's attention. Now question 45. A technique of child management towards a desired behavior is called. So the answer is option A, shaping. Shaping is a technique of child management towards a desired behavior. Behavior shaping is a form of behavior modification technique based on principles of social learning. It is the procedure that slowly develops desired behavior. The behavior shaping techniques are desensitization, tell show do, modeling, and contingency management. Now question 46. Shy and submissive child is the result of parents who are. So the answer is option B, overprotective. Shy and submissive child is the result of parents who are overprotective. Now question 47. Which of the following statement is true? Option A, Sigmund Freud, psychoanalytic theory. Option B, Jean Piaget, cognitive theory. Option C, Pavlov, classical conditioning theory. Or option D, all. So the answer is option C, Pavlov. Pavlov gave classical conditioning theory. Now question 48. Which of the following is not a component of psychic structure? Option A, ego. Option B, superego. Option C, superid. Option D, id. So the answer is option C, superid. Id, ego, and superego are the component of psychic structure, but superid is not. Let's see the explanation. Psychic structure proposed by Sigmund Freud is composed of id, ego, and superego. The stages of development of Freud's theory are oral stage, when the child is between 1 to 2 years. Mouth is the site for identifying needs, satisfaction of oral desires. For example, suckling helps in development of trust. Anal stage, it is when the child is between 2 to 3 years. Anal zone becomes the primary zone of pleasure. Gratification is derived from expelling or withholding feces. Overemphasis by parents on toilet training will result in compulsive, obstinate personality. Less controlled toilet training result in impulsive personality later. Third is phallic stage. It is between 3 to 5 years. Child develops attraction towards opposite sex parent. It is called as Oedipus complex in boys and Electra complex in girls. Fourth is latency stage. This stage corresponds with the development of mixed dentition and character formation. Maturation of ego takes place. Further development of personality and skills occurs. Fifth is genital stage. Sense of identity develops, can satisfy genital potency and realizes goals for reproduction. Okay. Now question 49. The phallic stage defined by Freud is seen in the following age group. Option A 1 to 2 years, option B 2 to 3 years, option C 1 to 5 years, or option D 3 to 6 years. So the most correct answer is option D 3 to 6 years. Now question 50. Which of the following is not a psychodynamic theory? Option A psychosexual theory by Freud, option B psychosocial theory by Erik Erikson, option C cognitive theory by Piaget, or option D social learning theory by Bandura. So the answer is option D social learning theory by Bandura. It is not a psychodynamic theory, it is a behavior theory. Now question 51. Fear of closed spaces like dental clinics is called as. So the answer is option D claustrophobia. Fear of closed spaces is claustrophobia. Explanation is phobia is an irrational fear resulting in the conscious avoidance of a known specific object, activity or situation. Types of phobia and the fear of. So acrophobia is the fear of height. Astrophobia is the fear of lightning. Agoraphobia, fear of open space. Arachnophobia, fear of spider. Anthropophobia, fear of people. Aquaphobia, fear of water. Nyclophobia, fear of darkness. Fear of darkness. Zoophobia, fear of animals. Xenophobia, fear of stranger. Pyrophobia, fear of fire. Claustrophobia, fear of closed space. Cynophobia, fear of dog. And trypanophobia, fear of injection. Phobia is defined as illogical and excessive fear of an object or situation. Xenophobia is stranger phobia. Okay. Now question 52. Which of the following uncooperative behavior is seen in physically abused child? So the answer is option B stoic. Stoic behavior is seen in physically abused child. Let's see the explanation. Wright's classification of potentially cooperative child's behavior can be modified and become cooperative. This behavior includes the following. Hysterical or uncontrolled behavior is seen in preschool children of 3 to 6 years at their first dental visit, characterized by temper tantrums. Defiant or obstinate behavior is seen in spoiled or stubborn child. The cry of the child is characterized by siren-like vocabulary. Timid or shy behavior is seen in overprotective child. Stoic behavior is seen in physically abused child. Winning type behavior is seen in complaining type of child. Tense cooperative behavior is borderline between positive and negative behavior. Now question 53. The term audio analgesia is also known as. So the answer is option D white noise. The term audio analgesia is also known as white noise. Audio analgesia or white noise is a method of reducing pain. This technique consists of providing a sound stimulus such as pleasant music to reduce stress and reaction to pain. Now question 54. Home technique should not be applied to option A 5-year-old child, option B who exhibits hysterical behavior during treatment but mentally sound, option C child who can understand simple verbal commands but exhibiting inconsolable behavior, option D immature frightened child. So the answer is option D immature frightened child. Home technique should not be applied to immature frightened child. Now question 55. According to American Association of Mental Deficiency Classification Scheme, a trainable mentally retarded child has an IQ range of. So the answer is option B 36 to 51. Explanation देख लेते हैं. IQ range and description. When the IQ range is 52 to 68, the mental retardation is mild. The child can be educated in special cases. When IQ range is 36 to 51, it comes under moderate category and the child can be trained to perform self-help skills. When IQ range is 20 to 35, mental retardation is severe and the child has abilities limited to simple language and basic help skills. When IQ range is below 19, the mental retardation is profound and the child needs custodial care. Custodial care is required. Now, question 56. Which of the following is true about physical restraints? Option A, Papu's board is for restraining body. Option B, use of restraining device is a passive method. Option C, pose straps are used for restraining extremities. Option D, all of the above. So, the answer is option D, all of the above. Physical restraints are last resort for handling uncooperative or handicapped patient. It can be active restraints performed by dentist or parents or staff, or passive with the aid of restraining device. For body, the restraints used are Papu's board, paddy wrap, bean bag and towels and tapes. For extremities, restraints used are pose straps and velcro straps. For mouth blocks, mouth props and banded tongue blades. Note, head positioner and forearm body support are the restraints used in uncooperative patients. Now question 57. A child of 10 to 11 years of age cannot follow the demonstration of tooth brushing technique, then he has IQ level below. Option A 36 to 51, option B 90 to 110, option C 70 to 75 or option D 52 to 68. So the answer is option A 36 to 51. IQ of 36 to 51 is moderate mental disability and the child might have difficulty in following demonstration of toothbrushing technique. Okay. Now question 58. When the cry of child is characterized by a siren-like vocabulary, it is called as. So we have studied about it. The answer is option D, obstinate. When the cry of child is characterized by siren-like vocabulary, it is called as obstinate. Now question 59. Hand over mouth technique was first described by. So we know its answer. Its answer is option A, Dr. Evangeline Jordan. Now the last question of this video. A dentist manages an uncooperative child by demonstrating the procedure on another cooperative child. This way of child management is called as. So the answer is option A, modeling. When the dentist managed an uncooperative child by demonstrating the procedure on another cooperative child, the way of child management is modeling. So We have done 20 questions in this video. In the next video, we will do the next 20 questions. So if you like the video, please do like and subscribe to this channel. Thank you so much.